Hello, I'm Darwin. Welcome to my Learn Hub. This is week 7 for PTA 214 lab clinical assessment. So for this week, I will be demonstrating two special tests. The first test is the anterior drawer test, which is a test for the knee. And we are testing, the anterior drawer test is mainly for assessing ACL laxity. ACL stands for anterior cruciate ligament. It's one of the pair of ligaments that stabilizes the knee. So anterior ACL, it restrains anterior translation and medial rotation of the tibia in relation to the femur. So you will notice in the video that I was trying to pull the lower part of the leg, the tibia part, upwards to see if there will be a rise right by the joint in the knee. That's the part that I'm looking for. If it will show more than 5 millimeter of rise. If it has more than 5 millimeter of rise, then that means the patient you're testing is positive for ACL laxity. So my subject Sina, he didn't show that much movement. It's nowhere near more than 5 millimeter of laxity or movement. So I concluded that he's a negative for anterior drawer test. The second test is for the hip, and it's called the Scour test. It's a pretty easy test in my opinion. So you just have the patient in a supine position with the hip flexed up to 90 degrees. This test, by the way, is to assess labral tear. So I just supported the heel and then the other hand, and then my other hand was pushing down on the femur towards the hip, going down. And as I'm pushing down, putting pressure, compression, doing internal and external rotation while observing for a clicking, grinding sound, which if I hear, that means they are positive for acetabular or labrum tear. And those are my two tests for this week. So the first thing I'm going to be doing is called the anterior drawer test. It's a special test to assess for ACL laxity. It's done with the patient in a supine position and with the leg that we're testing at about 80 to 90 degree angle. And I'm gonna have to ask you, Sina, to relax your hamstrings, okay? And then so you can press your foot against my leg like that. So we're gonna place our hands right on the proximal section of the tibia anterior, and the force is gonna be going to this direction. And as we pull it, what we're watching is if the portion right here, if the tibia will go up, or if there's a rise in this area. And if it shows that it has more than 5 millimeter of difference or dip, then he's positive for an anterior drawer test. That means he has a ACL laxity. So we're gonna do it right now. I see a little bit of laxity, but it's not, I wouldn't say it's more than 5 millimeter. So he's negative for anterior drawer test for ACL laxity. Hi, the second test I'll be performing is called the Scour test. So this test is again done with the patient on a supine position, and we are assessing for a labral tear. So I have Sina here in a supine position, and I'm gonna ask Sina now to have his hip at a 90-degree flexion like this. And also I'm gonna have to support the heel and the other hand right here on the patella, because I'm gonna be putting pressure towards the hip as I do internal and external rotation. So as I'm pressing down on his leg, on his femur toward the hip, what I'm looking for is a clicking sound, grinding sound. And you feel any pain right now, Sina?
I feel some pain in my lower back.
Lower back.
Yeah.
Okay, so if he's positive for some kind of pain, so it may be arthritis. It doesn't sound like it's a severe pain, right? So it's not acetabular labrum tear. So, but no clicking sound, no grinding sound as far as I could observe. And that's the Scour test.